Ever wondered what nephrologists actually eat for breakfast? The answer might surprise you, especially if you're over 60. Hi, I'm Dr. Sofia. I've spent more than 2 decades caring for adults 60 and older, and after talking with colleagues and watching hundreds of morning routines, I boiled it down to a 7-item breakfast approach that's simple, inexpensive, and built around one surprising priority. If you want a practical routine that respects aging kidneys, stick with me. Before we dive in, a quick favor. If you're watching from somewhere in the US, hit like and drop a letter in the comments for your usual breakfast. A for coffee and toast, B for cereal, C for eggs, D for no breakfast. I read every comment. Here's the short physiological frame that makes breakfast strategic for kidney health. Your kidneys aren't on or off. Each kidney contains about 1 million tiny filters called nephrons, and they don't all work at the same pace all day. For most people, the kidney's filtering activity peaks in the morning, roughly between 8 and 11 a.m. In plain language, those little filters run faster in the morning. What you give them in that window, water, nutrients, or excess sugar, matters because the kidneys will see a concentrated dose of whatever you consume. That's why your first meal isn't just fuel for your day. It's an opportunity to protect the kidneys or, conversely, to create avoidable stress. I'll count down from 7 to 1. For each item, I'll tell you what to prepare, why it can help the kidneys in simple terms, and a quick tip to make it easy to do every day. Save the most important reveal for last. The number one element is not a specific food, but a habit. Keep that in mind as you listen. 7. Warm water with lemon about 30 minutes before food. Not hot, warm, the kind you can comfortably hold in your hand, roughly 120 degree, 40 to 50 degree. Squeeze 1/4 to half a lemon into a cup of warm water and sip it slowly about half an hour before your breakfast. Why this helps? Gentle rehydration first thing supports kidney blood flow and urine production, and the citrate from lemon can help reduce the chance that calcium and oxalate crystals stick together, one of the common paths toward kidney stones. Citrate makes urine less likely to form those hard crystals. It also gently stimulates bowel motility, so less waste lingers in the gut, where some toxins can be reabsorbed. Practical tip, keep a pitcher of warm water ready or heat a cup, squeeze in lemon, and set a small timer. If citrus bothers your stomach, plain warm water works too. If you're on a low-acid diet for reflux or have certain medications, check with your clinician. 6. Rolled oats with Ceylon cinnamon. A simple bowl of half a cup of rolled oats, cooked or soaked, topped with a half to a full teaspoon of Ceylon cinnamon. This is one of those small swaps with big returns. Why it matters? Oats contain a soluble fiber called beta-glucan that slows the absorption of carbohydrates, smoothing out blood sugar spikes after breakfast. That smoother blood sugar pattern reduces a chain reaction of inflammation and stress that can harm small kidney blood vessels over time. Beta-glucan may also help bind small toxins in the gut and support beneficial bacteria that produce anti-inflammatory compounds. Cinnamon adds polyphenols that further blunt glucose surges and carry antioxidant benefits. Practical tip. Make oats the night before as overnight oats, or cook a small batch and portion it into jars. Use Ceylon cinnamon specifically when possible. Common cassia cinnamon contains more coumarin, which in large amounts can be harmful over time, so Ceylon is the safer everyday choice. 5. 1 or 2 eggs cooked low and slow in extra virgin olive oil with a sprinkle of turmeric and a grind of black pepper. This is a protein and fat combo that's both satisfying and kidney-friendly for most people. Why it helps? Good quality protein in moderate amounts supports muscle and prevents frailty without excessive renal workload when balanced across the day. Fat helps absorb turmeric's main compound, curcumin, which research suggests has mild anti-inflammatory effects in the microvessels, including those in the kidneys. Black pepper contains piperine, which increases curcumin absorption. Olive oil supplies heart-healthy monounsaturated fats that support vascular health. Practical tip: cook eggs gently, poached, soft scrambled or low-heat fried so they stay tender. Use about a teaspoon of extra virgin olive oil for flavor and absorption. If you follow a plant-based diet, a tofu scramble with a pinch of turmeric and olive oil can be a reasonable alternative, keeping in mind protein quality differences. 4. Fresh garlic, crushed and rested for 10 minutes, added to food or taken with the meal. This one surprises people who think garlic belongs only to savory dinners. Why it helps: when you crush a fresh clove, an enzyme converts garlic components into allicin, a compound shown to have modest vasoprotective and anti-inflammatory effects. Those effects can support healthy blood flow to the kidneys and reduce low-grade inflammation that contributes to kidney damage over years. Crucially, crushing and letting the garlic rest for about 10 minutes before eating gives time for allicin to form. Practical tip: crush or finely chop one small clove and let it sit for 10 minutes. Then mix it into room-temperature foods. Stir it into cooled oatmeal, blend into your eggs off the heat, or fold into yogurt or a savory spread. If raw garlic is too strong, mix it with a spoonful of olive oil or spread onto whole-grain toast. Important cautions: if you are taking blood thinners or have a planned surgery, check with your provider before increasing raw garlic. Allicin can affect clotting in some people. 3. A handful of fresh strawberries or an apple with the skin on. These are two easy fruit choices that pair well with oats or eggs. Why they help: both strawberries and apples have anthocyanins, quercetin, pectin, and other polyphenols that act as antioxidants and mild anti-inflammatories. They also add fiber that smooths post-meal sugar and supports gut health, and their skin contains important flavonoids. For most older adults, a small portion of these fruits is relatively low in potassium compared with other fruits, making them reasonable choices for people not on a potassium-restricted diet. Practical tip: rinse berries in a colander the night before and keep them in a ready-to-grab container. Choose apples with the skin for extra fiber, slice them and add to your oats or enjoy alongside your eggs. If you are on a potassium-restricted diet, confirm with your clinician which fruits are safest for you. 2. Green tea or hibiscus tea, unsweetened. Your morning warm beverage, but not sugary coffee on an empty stomach. If you love coffee, I'm not asking you to give it up forever, but consider having it later or pairing coffee with food. Why these teas help: green tea provides catechins and hibiscus offers anthocyanins. Both groups of compounds have antioxidant properties that protect small blood vessels and may support modest blood pressure reductions. They also deliver a gentler stimulant effect than a large cup of sweetened coffee, and without added sugar, they won't provoke rapid blood sugar swings that stress the kidneys. Hibiscus, in particular, has modest evidence for helping lower blood pressure in some people, which is relevant because high blood pressure is a leading driver of kidney damage. Practical tip: brew a cup after breakfast if you prefer coffee to start the day. If you want tea first, make it unsweetened and sip it with or shortly after your meal. Avoid high-sugar drinks. If you take certain blood pressure medications or have other conditions, discuss with your provider how hibiscus may interact. 1. Consistency. The number one element isn't a single food. It's the habit of doing a good enough breakfast every day. Repeating a simple, modest routine across months and years accumulates protection. Why consistency beats perfection? The kidneys are exposed to a lifetime of small insults or small protections. One flawless meal won't rewrite your renal history, and one missed morning won't ruin it either. What matters is the repeated pattern that reduces spikes in blood sugar, maintains steady hydration, supplies small anti-inflammatory compounds, and prevents frequent gut-to-kidney toxin reabsorption. Clinical experience and population studies suggest that dietary patterns over time are associated with kidney outcomes. Individual foods help, but habitual behavior is the real power player. Hold on. Before you think this is too much to do every day, let me give you a realistic low-prep protocol you can start tomorrow. The goal is to make it as frictionless as possible. Start the next morning. Practical plan. Upon waking, drink a cup of warm water with a squeeze of lemon about 30 minutes before your breakfast, warm enough to be soothing, around 100–120 degrees, 40–50 degrees. While the water is settling, prepare the oats or eggs. If you choose oats, make half a cup of rolled oats. Cook them or prepare as overnight oats. Stir in half to 1 teaspoon of Ceylon cinnamon before serving. Top with a handful of strawberries or apple slices with the skin. If you choose eggs, crack 1 or 2 eggs and cook them gently in about a teaspoon of extra virgin olive oil. Add a pinch of turmeric and a dash of black pepper near the end of cooking. Crush 1 small garlic clove and let it rest for 10 minutes while you prepare the rest. After the rest period, fold it into your oats at room temperature or into your eggs off the heat. Choose an unsweetened green tea or hibiscus tea with your meal, or have it shortly after. If you prefer coffee, have a small cup paired with food rather than on an empty stomach. Keep portions moderate. This is about a balanced first meal that minimizes sharp sugar spikes and gives the kidneys steady, manageable input. Substitutions and real-world tweaks. If you have gluten sensitivity, use certified gluten-free oats or try buckwheat porridge. Note, buckwheat has different fiber characteristics, so it's not identical. If you're vegan and want a protein option similar to eggs, a firm tofu scramble with turmeric and olive oil supplies protein and the same absorption benefit for turmeric. If raw garlic is intolerable, consider a small amount of cooked garlic or aged garlic extract after checking with your clinician. If lemons are an issue, plain warm water is still helpful. Let me tell you a short vignette to show how these small, steady changes add up. Mrs. Lords is a 69-year-old woman I follow in clinic. She was tired in the mornings, had a history of kidney stones years earlier, and her labs were stable but not ideal. We simplified her mornings: warm lemon water, overnight oats with Ceylon cinnamon and berries, 1 soft egg most days, and a cup of hibiscus tea after breakfast. She didn't need fancy supplements or expensive products, just repetition. Over 6 months she reported better energy, fewer mid-morning cravings for sweets, and her lab trends stabilized. I'm careful to say this is an anecdote, not a universal promise, but her case is exactly what clinicians mean when we say small behaviors repeated matter. Your results will vary and depend on medications, baseline kidney function, and other health conditions. Now, a few safety notes I must emphasize. This plan is geared toward generally healthy older adults and those with early-stage kidney disease who haven't been placed on strict dietary restrictions. If you have stage 3–5 chronic kidney disease, are on a potassium or phosphorus, restricted diet, are taking blood thinners or have a transplant, or are on immunosuppressants. You should check with your nephrologist or primary clinician before making changes. Specific examples: garlic can thin the blood and interact with anticoagulants. Turmeric in large supplemental doses could affect clotting or interact with certain drugs. Fruits and other foods have potassium and phosphorus that may matter in advanced CKD. I cannot overstate this. Personalized medical advice is essential for people with established kidney disease or complex medication regimens. A few other practical cautions. If you're on multiple blood pressure medications, adding hibiscus tea or significantly changing sodium intake should be discussed with your clinician. If you take diuretics, monitor your hydration and potassium levels per your clinician's guidance. For cinnamon, prefer Ceylon for daily use. Cassia cinnamon in large amounts can add coumarin, which can be harmful over extended periods. Small amounts of Ceylon cinnamon in food are safe for most people. Let's talk about habit design, how you actually keep this up. I use 3 principles with my patients: same time, small steps, and visual cues. First, try to eat breakfast within a similar morning window so your routine becomes a ritual. Second, pick one tiny change to start. Maybe warm lemon water for a week, then add oats the next week. Small wins build momentum. Third, make it visible. Set the lemon and a cup by the kettle the night before. Portion out oats into jars. Keep a small clove of garlic ready, or lay out your tea bag. Use calendar reminders or habit-tracking apps if that helps. If you miss a day, let it go. Consistency over 2 months matters far more than perfection on any single morning. A quick note on coffee, because I know that's many viewers' go-to. Coffee itself isn't forbidden. Moderate coffee can be part of a healthy pattern for many people. The issue comes when coffee is sweetened heavily, or when it's consumed on an empty stomach and replaced breakfast entirely. If you love coffee, try pairing it with the oatmeal or eggs, or delay that first cup until after you've eaten. Aim to avoid sugary creamers and large amounts of added sugar, which blunt the protective pattern we're describing. Before we wrap up, here's a 1-page mental checklist you can keep in the kitchen and follow tomorrow morning. Wake up, warm lemon water, 100-120 degree, 40-50 degree. Sip 30 minutes before eating. Prepare half a cup rolled oats with 121 tsp Ceylon cinnamon, or 1-2 eggs cooked low and slow in a teaspoon of extra virgin olive oil with a pinch of turmeric and black pepper. Crush 1 small garlic clove and let it rest 10 minutes, then fold into your oats at room temperature or into eggs off the heat. Add a handful of strawberries or an apple with the skin. Sip unsweetened green tea or hibiscus with or just after your meal. Repeat this pattern most mornings. Prioritize consistency over perfection. If you've got barriers, limited appetite, dentures, digestive discomfort, there are realistic workarounds. Smaller portions more frequently, blended preparations, soft fruits, and protein shakes based on physician-approved formulations can help. For those on strict potassium or phosphorus control, your clinician or renal dietitian can tailor fruit and protein choices so you still benefit from the pattern without risking lab imbalances. Before I close, one last scientific humility check. When I describe how these foods may help, hydration improving renal blood flow, citrate reducing stone risk, beta-glucan smoothing glucose, curcumin and allicin lowering inflammation, these are mechanisms supported by research and clinical observation. They are part of a preventive lifestyle pattern. They are not magic bullets. Changing your morning routine is one practical lever among many. Blood pressure control, glucose management, exercise, smoking cessation, and medication adherence are all crucial for kidney health. So which of these 7 will you try first? Will you start with warm lemon water, swap cereal for oats, add a crush of garlic, or commit to doing a simple breakfast every day? Tell me in the comments which letter is your pick, and I will read and respond. If this was helpful, subscribe for weekly, practical, kidney-friendly tips tailored to older adults. I'll be back with more clinically grounded, simple routines that make a real difference over the long run. Remember, your kidneys notice what you do day after day. Small, repeatable choices beat perfect, occasional ones. Start tomorrow, keep it simple, and let consistency do the heavy lifting.